All right, we're going to get going here. All right, everybody, welcome to the next session of our Sharing the Love for Healthcare virtual forum. I am Mrs. Hoyt, the Future Ready Coach at Bettendorf High School. I have with me Mary Johnson. Mary, you want to introduce yourself?
Hi, I'm Mary Johnson. I'm the career coordinator at Pleasant Valley High School.
Awesome. And Lauren, you want to go ahead and introduce yourself?
Hi, I'm Lauren Hargrave-Lamock. I'm the CTE Work-Based Learning Coordinator at Davenport.
Great. And I know we also have Mr. Schneider, who's with us from North Scott High School, and with his classroom waving over at us. So those will be your contacts, students. If you have any questions following any of these sessions, you'll want to make sure to get in touch with us. Right now, this session is direct to patient care, nurse practitioner, and respiratory therapist. So I'm going to actually let our panelists introduce themselves. So if we want to get the next screen up, Ms. Johnson. In just a moment. All right, perfect. So first up, we will go ahead and let Tori, our respiratory therapist, introduce herself. Go ahead, Tori.
Hello, everybody. My name is Tori, or Victoria. I'm the clinical specialist for Unity Point Trinity and Muscatine. I am a registered respiratory therapist, and I just completed last year my bachelor's in respiratory. I've been a therapist for about 11 years. And all at Trinity. And then I became the clinical specialist about 8 years ago. I also added on recently, I work PRN at Select Specialty Hospital in Davenport. And I also am COVID testing for St. Ambrose University also.
So just a little busy.
Yes.
Just a little, not too much going on.
Right.
All right, awesome. Meg, would you go ahead and introduce yourself, please?
Yes, hi, my name's Meg Dean, and I am a nursing faculty member at Trinity College of Nursing and Health Sciences. And I have worked with Tori for many years because prior to being nursing faculty, I worked as a staff nurse on med-surg as well as in the NICU, the neonatal intensive care unit, pediatrics, labor and delivery. I've worked as an educator at the hospital. I have been a manager of the labor and delivery and mother-baby departments at the Bettendorf campus. And Tori has saved me many a times coming to the rescue when we have a baby who is in need of ventilatory support. So it's great to see someone I work with and respect so much here on the panel with us. I graduated from Trinity School of Nursing with Mrs. Hoyt's mother many years ago. Yay! And then she was a class a couple of years ahead of me, actually. And then finished my bachelor's in 2004. I was the mother of 5 children at that time when I finished my bachelor's. Went on then to get my master's in 2016 when I was a nurse manager, because I knew that education is really where my heart was. It seemed to be kind of like the theme throughout my career, teaching prenatal classes and just a lot of different educational points within my career. And I knew I wanted to be faculty. So I took a faculty position then in 2016 upon graduation, and a full-time position, I should say. And I'm currently working on my doctorate in nursing leadership and should graduate this year. So maybe not as busy as Tori, but busy in a different way. So
I was going to say, I think we maybe ask the most busy people in the world to do these things. Well, thank you. And then Ashley, would you like to introduce yourself?
Yeah, my name's Ashley Scobie. I am a family nurse practitioner. So I'm a new grad. I graduated in May of last year, so I'm on my first job as a nurse practitioner right now. Before that, I was a nurse. I worked in the ER, and then I was also a school nurse for a couple of years before deciding to go back and get my doctorate in nursing practice as a family nurse practitioner.
Awesome. So yes, we have quite an array of backgrounds and information to share with all of our students today. So like I said, we like to get started in these sessions with just kind of a baseline of how you're kind of spending your day, what's going on. We're going to throw up on the screen. That sounded really bad, throw up on the screen. We're going to put up on the screen a little description of the career. And so Meg, we're going to have you speak specifically to what it is to be a nurse. So if you don't need to read what's on the screen, they can read that. But if you just want to talk kind of about being a nurse and what your day-to-day looks like right now for you.
Absolutely. I will have to say there's very few things in my life that I don't have a little bit of regret for. You know, we make decisions as we go and say, oh, I wish I could have done something differently. And the one thing that's been very solid is my decision to follow a career in nursing. My career in nursing has been very good to me. And I still, even as a faculty member and through my other positions as being a manager and things, I've always remained at the bedside working in a PRN or like a very part-time capacity, continuing to care for patients because it's just so rewarding. So when I work as a nurse at the bedside, it's really all about blending the science of nursing along with the art of nursing. And that's that relationship building that you have not only with your patients, but families and your coworkers as well. So when, for example, in the NICU, we have responsibility for attending deliveries, high-risk deliveries, admitting babies, starting IVs, giving medications, working with moms and babies on feeding plans. Most of our moms are breastfeeding, and I also am a board-certified lactation consultant, so that's an area of practice that I really enjoy. Collaborating with neonatologists and nurse practitioners specific to that area of practice, and really just getting these babies off to a good start so that they can bond with their parents and get strong and ready to go home and make that big transition from being a premature or sick baby to that healthy baby that all parents are expecting. So I typically work 12-hour shifts, but the wonderful thing about nursing, and as I told you guys, I have 5 children, is that it's incredibly flexible. So you can pick up short shifts. We call them princess shifts, 4-hour shifts, to just come in, you know, get a little hands-on patient care, socialize a little bit with your great friends that you make in nursing, and then go home. Or you can work very full-time, working 12-hour shifts. Some units do still have traditional 8-hour shifts. It's a hospital. You know, hospitals run 24 hours a day, and so we do have nurses that work a variety of different shifts. We have nurses that work the night shift, which works out really well sometimes for parents of school-age kids because they can sleep while their kids are in school and then still be available to get them off to school, see them home off of the bus, help them with homework and those kinds of things before heading back out to work. And we also have special shifts like weekend packages where nurses can just work weekends and make a really nice differential. It's a really nice bump in pay to be able to do that and then be home during the week. That's especially nice for nurses who have small children and don't want to place their kids in childcare. So the one thing that I would say has been really great about nursing is there is a job for everyone. Not everyone's cut out or wants to be an ER nurse, and not everyone's cut out to be a nurse maybe at the health department. There are very different tracks, something for everybody depending on your interest, your skill level, your time availability, and also your level of income that you need to achieve. So there's a lot of opportunities for overtime, incentivized pay. And of course, if you go on for your education, that's going to open even more doors of opportunity for nursing leadership positions within your hospital system or your community. And there's no such thing as a place that isn't looking for good nurses. So you can literally go across the country if you want to. There are nurses that do travel assignments and things like that that really kind of just, I don't know, give you that boost of excitement and sort of broaden your horizons. So every day in nursing is different, and that's one of the things that I like about it. There are certain things that are the same that you can expect, standards of care and those types of things, but there's something different every day. You get to meet interesting people, solve complex health problems, and really make a positive difference in the lives of people you care about in your community. So nursing has been a very good fit for me, and I look forward to maybe meeting some of you who think maybe nursing would be a good fit as well.
Yes, definitely. Well, thank you so much for sharing. That was really, really great. Let's see, who do we have next? Okay, so then we're going to jump to respiratory therapy. So Tori, if you want to tell us kind of about your day today and anything you want to share.
Sure. So actually, a lot of what Meg already said, respiratory and nursing kind of go hand in hand. Some of the shifts are the same. We work 8-hour shifts. We can work 12-hour shifts. We do what she called, I hadn't heard that before, the princess shift. That was
I like that.
but we have princess shifts too of 4 hours where we come in and just help the staff out and then go home. The only thing we don't currently have is we don't have weekend packages. That would be kind of nice, but we're a small department. So instead of having, hundreds of nurses in the hospital, we have about 55 therapists that cover 4 different campuses. So, the staffing ratios are a little bit different. A nurse may have 3 or 4 patients assigned to them. I typically could have up to 30 patients that I'm assigned to, depending on what they're getting, what kind of medications, and how sick they are. So that's one of the differences between nursing and respiratory is kind of the staffing, how we do it. It has been, I started in nursing and decided very quickly that was not for me. I thought that was, I didn't really know anything other than nursing. So I thought when I wanted to be in healthcare, that was what I had to do. I wasn't going to be a doctor. So I thought that was where I belonged. And I found about a year in that I don't think it was for me. And what else was there? What else could I do? So actually I went to Trinity College and I thought, well, maybe it was the program I was in. Maybe I just need a different teacher to make it more exciting for me. So I applied to Trinity and they said, well, have you heard about respiratory? And I was like, I have no idea what you're talking about. So she kind of told me and I was, well, maybe that could be for me. So I applied to both programs thinking that God would give me the answer by giving me one. I both.
Oh, darn.
Yes. So I decided, since I'd already tried the nursing thing, that maybe this happened for a reason. I took respiratory and I knew within like a month that was where I belonged. I understood the material very quickly. I was catching on to it very quickly. But as far as like day to day, when we come in, we obviously with COVID, we have taken on a lot more responsibility, a lot sicker patients than we're typically used to seeing in mass amounts. So we are at the bedside and we take care of the life support. So the ventilators are all taken care of by respiratory. We do all the titrating, all the weaning patients from the ventilators. If they become trached, then we still take care of the ventilator when they're trached. We take care of CPAPs and BiPAPs, which are other breathing stabilization units that we take care of. We draw blood to help us with our diagnoses. There's all different things, kind of like nursing. You can do like hospital, or you could do, in a doctor's office, things like that. We also have those kind of tracks. So you could be a staff respiratory therapist in the hospital. We have respiratory therapists that take an extra exam to do sleep studies, people who have sleep apnea. There's respiratory therapists that do pulmonary function testing, which is another exam that they take, and then they do breathing exercises and testing with patients to diagnose them. We're starting to get into doctors' offices, so they're using, in pulmonology offices, they're using respiratory therapists to train or teach patients on medication usage. So that's starting to go there. And then there's people like me who either are in management or I'm the clinical specialist, which is basically, I do all the education. So I do education with like Meg and the nurses. I also do all the education for new therapists coming in. I train them. I do all the yearly competencies. Any new equipment that comes in goes through me to decide if that's the kind of equipment we want or where it should be used. So I take care of all those things. And I'm also in staff currently because our patient population has been so much that I've had to do both numbers. So it has honestly probably, like Meg, it is one thing in my life that I've never regretted doing. It's probably one of the best decisions I ever made. Going in and seeing these patients go from I can't breathe to walking out the door is amazing, really. Because I can't imagine probably one of the worst things to do would be to not be able to breathe.
Right.
Your girl. So it's even been probably more rewarding this last year, seeing our COVID patients that have come in, been so sick, and then I get to walk them out the door to go back home. So it's been pretty amazing. And we're finally getting some recognition. People know who we are because so that's been really nice for us.
A pandemic to find out who you were.
I know it shouldn't have happened, but I'm like, oh my gosh, look it's talked about us on the national news. They know who we are. So yeah, it's been great.
Oh, good. Thank you for sharing.
Yep.
Okay, Ashley, you want to talk to us a little bit about, why don't you start with nurse practitioner, but then I might have you also just talk a little bit about school nursing too.
Yeah. So nurse practitioners, you have to have your degree in nursing first. So I got my bachelor's in nursing. And then some programs require you to work a couple of years as a nurse before going back. Others you can go straight through. I worked for 2 years as a nurse before I went back to school. So nurse practitioners, I like that you put in this description, it can vary from state to state because it really can. Here in Illinois, nurse practitioners can get something called full practice authority after they've worked for 4,000 hours under a doctor's supervision. And then they can really function more independently, seeing patients. Again, with kind of like with nursing, there is a variety of things you can do as a nurse practitioner. So my degree is in family nurse practitioner, so I can really see and treat patients from birth to death. There are other specialties like you can be a pediatric nurse practitioner, you can be a neonatal nurse practitioner, you can be an acute care nurse practitioner, which would be just working in like an ICU. But with the reason I chose to do family is I feel like there's a wider variety of options. So again, like nursing, I could work in a doctor's office, and that would be seeing patients every day, doing physical assessments, treating illnesses, ordering medications for them if needed, follow-ups, physicals, all that kind of stuff. They also take, family nurse practitioners can work in different specialty areas. So I work in a hospital setting. I work with the hospitalist group. So I am only functioning in the hospital. I don't ever go to a clinic to see patients. I only see hospitalized patients. And those patients can be anywhere in the hospital besides the ER or the ICU. So we take care of patients with a variety of medical problems, something like pneumonia, we're dealing with their lungs, or we even take care of patients that are having heart issues, and we work with cardiologists. So a lot of it too in the hospital is collaborating with other specialties, so we'll have a patient that maybe came in for something like a stroke, but they have other medical diagnoses like diabetes. So while a neuro doctor would take care of their stroke, then a hospitalist takes care of their everyday problems like diabetes and high blood pressure and anything else like that. So it's a lot of working with other specialties as well. But I have some friends that I went to school with who are working in those specialties like GI. So taking care of patients with, gastrointestinal problems, or I have a friend that works in infectious disease. So she only deals with, infections and that kind of stuff. So the great thing again about being a nurse practitioner is you're not limited to one specific area. You can move around. So I work in the hospital, I work night shift. So I work 4 10-hour shifts a week. So I go in at 9:30 p.m. and I get off at 7:30 a.m. And I work every third weekend. So, but if I didn't like that or wanted to do something different, I could go work in a clinic setting where I would work like a Monday through Friday job. I love working in the hospital setting. I was an ER nurse before, and I like kind of a little bit of chaos in a way. I like to be busy. I don't like kind of like monotonous stuff. And so that's been my favorite thing about working as a hospitalist is I do get to see a variety of patients. So throughout the night, my typical kind of night is I have a pager. And so on average, we have about 160 patients in the hospital under our hospitalist group care. So if any one of those patients needs something throughout the night, their nurses page us, the nurse practitioners take care of that overnight shift. So whether it's, a patient needs some pain medicine because their pain is out of control, or a patient's blood sugar is really high and they need some insulin. So we're constantly getting those kind of pages and take care of that kind of thing. But then also if patients are kind of really sick, if something changes and they become very short of breath, we'll go see that patient. We work with respiratory therapy, and we work with a bigger team, and we do more tests on the patient. And then, if they need to go to the ICU, then we send them to the ICU. So my nights are always kind of different. There's not really a typical night. And that's so far been my favorite part of the job. Is I like that it's different every night I go to work, and I'm taking care of a wide variety of patients.
Yeah, that sounds like it. And I feel like probably all of you, because you're so busy, I mean, I say this jokingly, you probably sleep really well because you're just like exhausted and you hit the pillow. But then I know you because my mother is a nurse, and I know your minds are still going, so it isn't as easy. But you just have to be exhausted by the time you all get done. I'm tired right now just hearing everything you all do. So that's great. Well, Ashley, we will come back if we have the chance, and let's talk about school nursing a little bit. But I want to make sure that we dive into these 3 positions because our students signed up for them. So I'm just going to start asking questions, students, and if you guys have additional ones, please pop them in the chat, and we'll make sure we get through those ones too. You all, this is our first group who, like, you guys answered a ton of questions within your couple minutes of explaining things. So if I do have you repeat something, just go ahead and give us a brief overview again, and I apologize if I do. Let's talk just real quick about how you get into the different departments. So maybe not so much, because it sounds like with respiratory therapy, you're just like, wherever we need to be, here's where we go. So maybe when it comes more like Meg with nursing, I think both you and Ashley kind of talked about, well, if I want to go to this department, or if someone wants to work in this department. So let's say I'm a new nursing student, and I need to figure out what department it is I want to work in. Meg, how do they figure that out?
Oh, I love that question because it's, I know when I was thinking about nursing school, I remember walking past the nursery, and this was back when in the day when the babies were in the nursery. Now they're out with their moms, but I just remember like gazing through that window and thinking, how did that nurse get this job? Like, what a dream job this would be to have. And never in my wildest dreams did I think I would end up managing the department that I once dreamed of working in. And so our nursing students at Trinity College, we have a bachelor's degree program. The wonderful thing about nursing in the Quad Cities is there are 4 programs available. There's Scott Community and Blackhawk both have associate's degree programs. And then we have, of course, St. Ambrose and Trinity College that have bachelor's degree programs. And then we also have advanced degree programs as well. And during your nursing school, you will be exposed to a variety of different clinical settings. You start out with the basics, kind of the meat and potatoes of nursing, which is adult health care. Then you dive into mental health. And right now, as we speak, I had to step away for a moment because I am with a group of 7 students in the OB department, and a student had a question for me. So right now they're experiencing the NICU and lactation consultant role, labor and delivery, OB triage, mother baby, their nursery. So they're getting a lot of nice variety of experiences. They'll go to the ED, they'll go to the ICUs. They will go out into the community for home care, school nursing. We really expose students to a variety of different clinical settings because it's important for students to figure out what they like, where their skill sets fit in, the culture of different positions and jobs and organizations that they may feel most comfortable in. So we get our students really out and about in clinical so that they can just gain a lot of perspective. And then we have got a preceptorship program that allows students to choose an area of practice that they're specifically interested in. And then they immerse themselves over the summer that they graduate, and just work hip to hip, one-on-one with a nurse in that clinical setting to really get a feel for what is it like to really be a nurse in this department and gain that autonomy and independence throughout the summer. And then they're really ready for that first job. We've heard back from employers that have hired our graduates that those that did their preceptorships had a much easier transition into the role and really were a good fit. So I think that's a great advantage and a way that students can kind of just get experience in a lot of different things, maybe things they never thought they'd be interested in. I had a student who was really wanting to work in the ED, and she works there as a tech now. So she has an idea of what the ED is. And I had her a clinical day with the lactation consultant for a pediatric rotation. She was not excited about it. She just didn't see herself really having any interest in that area. And when I went and visited her that day in clinical, she's like, oh my gosh, I think I want to be a lactation consultant. This is the coolest job ever. Like, how do you get this job? And so one of the things that I'm really interested in, and I worked for Mrs. Hoyt's mother at one time in the HR department, just interviewing people because I love career tracking. So one of my favorite jobs at the college is my role as a faculty advisor to students, helping students to kind of map out some career plans to get students the experience that they need, as well as the information they need about specific jobs, help them with resume building, those types of things, so that when they graduate, they're really set up for success clinically, but also set up for success to begin utilizing some of their leadership skills and really making a difference in healthcare and in their communities. So did that answer your question, Mrs.
Yeah,
White?
I would say so.
Awesome. Okay, great.
So Ashley, is that kind of what you experienced then when you were trying to decide what track for you as a nurse practitioner? Did you get that same kind of exposure?
Yeah, so it's the same kind of setup with NP school. You start out with just your kind of adult health clinicals. So I was in just like a family medicine office, seeing lots of patients. I also did a clinical in like a pulmonary office, so then I'm just seeing pulmonary patients. So I think it's similar when you're exposed to those clinical situations. You kind of feel what you're pulled to, and I think the biggest thing with nursing and nurse practitioner is you're not set in stone in one area. So, doctors go to school, they go to medical school for 4 years, and then they do some type of residency, and that's where they practice. So if you want to be, if you want to take care of cancer patients, if you want to be an oncology doctor, that's what you do. That's it. So as a nurse practitioner, you can kind of move around. So when I did my clinicals, even once I graduated, I still didn't really know what I wanted to do because I enjoyed so many different clinicals.
Oh, sure. Yeah.
And I think that's one of the great things about being a nurse practitioner and being a nurse as well. It's if you, let's say that you think that you want to work on just maybe a general medical floor, and you get there and you're like, well, this isn't really for me. Or, as a nurse practitioner, I told myself going into this hospitalist position, I'm going to do it. I'm going to try it. If I don't like it, there's nothing saying that I can't move and find somewhere else that I enjoy. When I was doing my clinicals, another area that I really loved was women's health, doing that OB-GYN rotation. And so, eventually I kind of see myself moving to that role too. So there's a variety of things that you can do. You're not really stuck in one position. So I think that's great. And I really think I tell, my friends that are in NP school right now, like, it's okay if you graduate and you don't know exactly what you want to do. It's okay, because you can be interested in multiple areas. And so I think just finding what fits best for you.
Yeah, I think that's something we've really heard in a lot of these sessions that we've done, is that you don't have to have it all figured out. And a lot of times we have our students come to us and say like, okay, I need to be a NICU nurse. How am I doing it? Well, I can tell you how you're doing it, but I can also tell you you're going to pass about 7 other things that are going to interest you in your, in your training. So like, you don't have to lock in, and it's not a bad thing, and you shouldn't feel uncomfortable if you don't know what you want to lock into. So I think that's great that you all have shared that. Okay, so with respiratory therapy, even though you kind of cover everything, I clearly know a lot of healthcare people. And so I feel like you do get to kind of specialize, like if there's something you like a little bit more.
Right. So, I mean, in school, you're going to hit all the areas just like the nurses do. We get them in NICU, in peds, geriatrics, ICU. They're going to go to all those areas. In this area, with the 2 hospitals systems here, if you work in the hospital, you will have to see every age group. Because of the way the staffing is, we don't typically keep a separate staff for adults versus pediatric and NICU. You have to be well-rounded enough to go to all of those areas. Mm-hmm. Go to larger places like Chicago and larger cities. then you can specialize. So if you want to be in the NICU, they have just NICU respiratory therapists or just pediatric respiratory therapists. So in bigger areas where they have those larger hospitals, you can do that. But then, like I said, you can also do, you can get right out of school and take an extra exam and just work in pulmonary function testing or in the sleep lab, if sleep lab is something that you like.
Oh, sure.
So there are other areas that you can do. Most of the other areas, though, you have to have the base, like just like the nurses of having like a med surge experience. You have to have like the base respiratory therapy in all areas, a lot of times experience before you can move to the NICU and the peds and work in just those specialized areas. And there's extra exams you have to take. So you can't just say, I graduated from respiratory therapy school and now I want to be in the NICU. You have to work so long in the hospital, and then you have to study and take a NICU exam to be credentialed in the NICU. So there are extra exams to do those areas.
Okay. So while you mentioned that, I see the question about travel nursing. We're going to come to that in just a couple minutes. But while we're talking about like kind of that education and that pathway, Tori, could you just kind of speak about if they want to become a respiratory therapist, what's the pathway? Where are they enrolling in school? What are they doing right now?
So currently there is no local respiratory therapy school. Trinity used to have one, which is where I graduated from. So now probably the best thing to do would be to get your prereqs done at like Scott or, a community college. And then the closest ones would be Peoria, Burlington, I'm trying to think, Cedar Rapids, I think has one, Des Moines, those outside areas. So it would be just like nursing. You would start with your associate's degree. So you get your prereqs, all your AMPs, almost everything that you'll take in respiratory, your prereqs will be the same as nursing. So you're going to take all your prereqs and then you'll do 2 years of your core studies in, I say, everything from the waist up.
I like that.
Basically what we do. Now, that's not to say that one thing about respiratory is people think that we're just the lungs, but they will learn very quickly that every organ in the body, when it fails, it affects the lungs. So you have to know how, when something happens with those other organs, how it's going to affect their breathing and what's going to happen in the lung area that I'm going to have to fix, or their brain, because the brain is where the breathing is coming from. So if we have a brain problem, that's going to affect my breathing. So they're going to study in all those areas. And then when they graduate, they'll have an associate's degree. They used to have to take 3 board exams. You would have to take a board exam to be a certified respiratory therapist. You would take a second exam to become a registered respiratory therapist, a written exam, and then you would have to take a clinical SIMS in order to have a completion of your registered respiratory therapist. Just this last 2 years, they changed it now that you will take a first exam, and if you get a high cut score, you'll move on to the clinical simulation exam. If you get a low cut score, then you would need to retest to get a high cut score to move on to the clinical SIMS. They could either get it in 2 tests or they could get it in 3, depending on how they.
Sure.
So then they would be able to go ahead and start working. Most hospitals will only take you if you're a registered respiratory therapist. There are some still hospitals and places that will take you as a certified respiratory therapist, but it's really starting to go away. You have to be registered. It'd be like an LPN or an RN.
Sure. Okay. So,
and then after that, you can get your bachelor's. You can get a master's in respiratory. I have a bachelor's from the University of Cincinnati.
Okay.
You can get a master's in respiratory. And now they have started an advanced practice respiratory therapist that would almost function like a nurse practitioner, but in.
Oh, that's neat.
Yep. So I'm on that route to get there.
Oh, that's exciting.
They would be almost like a hospitalist, and I would take care of all the intubations, all the, ventilator, everything, basically like a nurse practitioner, only they call them advanced practice respiratory therapists.
Oh, wow. That's exciting. You got to let us know when you're done with that. We're going to have to chat again.
It's going to be a little bit, I think. working there.
We'll get there. So I know sometimes when we talk about the certification and the tests that our students need to take, that can be kind of daunting. But I feel confident in telling our students that the programs, especially the ones in the area that we're familiar with, they are preparing students for these tests. So it's not like you're walking in there and it's a pop quiz that you've never seen these things before. They should all, by the time they're going through their programs, feel very confident when they're walking into that test, right? Yes. Okay.
Yes.
I don't think we need to go anymore. I think they should find confidence in that for sure. So I just want to really briefly, and maybe Meg, you're probably the best one to talk to this being an instructor. I feel like students are maybe more confident in what do I need to do to become a nurse, but can you kind of just talk about maybe getting that associate's degree and then adding on to it? And before you get started on that, students I just want you thinking about how Tori just shared that they're very similar prerequisite classes. So don't worry if you're not exactly sure, do I want to be a nurse? Do I want to be a respiratory therapist? Get the classes done. Don't let that hold you back. And then with what Meg is going to share, you can kind of start making your decision of which route you're going to go on.
Yeah, so there's a couple different tracks to becoming a registered nurse. You can get an associate's degree. Like I mentioned, you could get that at a community college, or you can get your bachelor's degree. The thing that is similar between the two is you pretty much need the same prerequisites. For the bachelor's, you need a few additional prerequisites. When you get your prerequisites, it's probably going to take you a good probably 3 semesters to get all of those accomplished: anatomy and physiology and English and speech and Psych 101 and all of those kinds of courses. And then you will then start your nursing courses. So you have to apply to a college of nursing or school of nursing at either a community college or one of our bachelor's programs, Ambrose or Trinity. And once you start those nursing courses at any of the 4 programs locally, it's going to take you 2 years. So really getting a bachelor's might take you an extra semester than getting your associates. And it's just because of the way it's set up and that you have to get those prerequisites before you can begin the nursing courses. If you choose to go for an associate's degree route, which is a great option for many people, you can then do what's called a BSN completion program, where you get your bachelor's degree, and those programs are primarily online. There may be a little bit of clinical, but it's because you're already a licensed registered nurse, you don't have to have that faculty oversight that someone who does not yet have that registered nurse designation for clinical. So most of the programs are online. A lot of our local organizations, Trinity, Genesis, have got great tuition assistance programs for students who are either pursuing their initial RN degree or who are doing that bachelor's completion program. And then of course there are master's programs. We have a master's program at Trinity. St. Ambrose, I believe, now has a nurse practitioner program that's newer. So there is a lot of local resources for students to have that face-to-face interaction that I think is so valuable when you're in a career such as healthcare. And I know for myself, I got my diploma. It was back when it was a hospital diploma program for nursing. Then went on for my bachelor's at Trinity College and my master's at Trinity College. And the reason that that was comfortable for me is I knew the faculty, I knew the healthcare system. I sort of knew what the expectations were, the culture, and it was a really nice fit. I tried an online program and I felt very disconnected from it. I think it works for some people. It didn't happen to work for me. I much preferred that interaction and those relationships that you can develop when you're kind of more local. So there's a lot of different ways to kind of go about it, but associates or bachelor's is where you have to start from in order to sort of move on to like the nurse practitioner, nurse educator, any of those types of positions.
Okay. And so if a student was like, travel nursing is very popular right now. I think we've all been in our houses for too long is probably why people are excited about it. But so a travel nurse would prepare the same way. And then it's just when they're applying for jobs, they're applying for travel positions with travel companies, right?
Correct. However, to be qualified to work as a travel nurse, you've got to have some experience first. You know, students are on a really steep learning curve throughout their education, but where a lot of the real deep learning happens is that first year out of nursing school, where you're really learning how to apply what you've learned and developing your critical thinking and your intuition and just your communication skills with physicians and families. That all takes a little bit of time to really feel comfortable in your skin as a nurse and be ready to be thrown into anything. and not feel like you're sinking, but at least feel like you're doggy paddling and keeping your head above water. Because those travel nurse positions are a very exciting opportunity. That's where there's some money that can be made there, and it also just allows people to just explore different health systems, different options. And a lot of nurses are leaning toward that, especially during this time of COVID. And I think some of it is financially driven, and some of it is, like you said, you're kind of getting stir crazy in your home. So you've got to have a couple of years experience in whatever area you're doing, at least one, but many of the travel agencies will require two.
Okay.
If you're in a specialty area like the emergency room, the NICU, pediatrics, they may require additional certifications because they want to know that the nurse that they're putting in that new environment with very little orientation is ready and up for the challenge and has the skills they need to be able to provide safe care. So I would say get that degree, get working for a year or two, decide what you like, and then go for the travel. It's a great gig. They're usually 12 weeks in duration, and you can literally go anywhere.
That is so exciting. I can see why the students are excited about that.
Yeah, if I were younger, I would do it. Totally.
Yeah, without 5 kids.
Yeah.
And you can do that as an RT too, just so you know.
You can
and
do travel, respiratory
you can do
therapy
this
also.
Yep, same thing.
Exciting. What about travel nurse practitioning? I don't know about that one.
Yeah, they do that.
They do?
Mm-hmm.
Oh,
yeah.
Cool. Okay, that's super exciting. Okay, so we talked a lot about the mechanics, I guess I would say, about it, of like, how do we get there? What do we do? So let's give our minds a break and let's focus on our hearts here for a minute, people. So Ashley, do you want to start for us and tell us like what has been the best day of being, okay, so maybe it's not from your nurse practitioning yet because that's newer, but maybe you have something, but maybe it's from ER or from school nursing. What has been the best day of being a nurse for you so far?
Okay, so I'm going to kind of rewind for just a second, if that's
Sure.
okay. I don't know if I maybe explained exactly like what a nurse practitioner is. I think that is sometimes confusing for people.
Okay, yeah,
like,
go with that.
Like
yeah.
nurse to nurse practitioner.
Sure.
So as a nurse practitioner, you kind of function more in that like doctor role, physician role. You can really see your own patients. You can make diagnoses. You can prescribe medications. You can treat. Whereas a nurse, you still do assessments and, you're still treating the patient, but you get those kind of orders from either a doctor or a nurse practitioner. So as a nurse practitioner, I get to kind of do things more on my own. I get to make those decisions in the patient's plan of care. I'm really kind of functioning more on my own than as a nurse. So I hope I explained that. Okay. I know it's a little bit confusing.
No, yeah, that's great. Thank you for going back.
So I actually, when I was going to school to be a nurse practitioner, I got to spend a week in Costa Rica. I did like a medical mission trip where we got medical services to people who have never had that before. So we were going to very, very, poor areas of Costa Rica. And we were seeing patients that, were 50 years old and they've never had medical care in their life. And we were seeing even, babies who had never been to a checkup before. And so, because they were born at home and they didn't have access to care. And so what we did is we were doing health assessments. So we were checking their blood pressure. We were, looking in their ears, looking in their eyes. We took vitamins down with us. We took some antibiotics down with us. So if we saw any type of like infection, we saw a couple kiddos with strep throat or like ear infections, we could give them the antibiotics that they wouldn't have access to. And even just things that we take for granted here, like ibuprofen, we saw a lot of patients with backaches because they work in coffee fields picking coffee beans. And so we just giving them ibuprofen to take was huge for them. And so while it necessarily wasn't one day that has been the best day as a nurse practitioner, that was the best week. And it really brought me back to why I went into healthcare and really helping people that need it, that, you know, they just truly didn't have access to healthcare, and seeing the way they responded to us, and they were so appreciative. And, you know, there was that language barrier, but you could still just feel the appreciation that they had for us being there. And that really just kind of refreshed me to make a difference in people's lives. And that, you know, really made me realize why I chose this career path. I think as a nurse, especially right now, in a pandemic, you can get a little burnt out, and you can feel, you know, a little bit jaded in a way. And so that really, it just really brought me back to why I chose this. And it was one of the best weeks of my life, and I would do it again in a heartbeat. So.
Oh, I bet. Wow, that is wonderful. You guys are going to make me cry again. Holy moly. Okay, Meg, would you like to share with us your favorite day? It can be a week.
Well, I don't have a
regular.
favorite day. You know, I've got 27 years as a nurse, and there are lots of things that stand out. I would say as a nursing faculty, I get a lot of joy in seeing these students succeed, seeing their light bulbs come on, and hearing that they've passed NCLEX, and hearing that they've found a career track that they love. I'm Facebook friends with many of them, and I see that they got acceptance letters into nurse practitioner programs, and it's just so exciting to see people be able to really live out their dreams and feel very fulfilled in a career. We spend a lot of time at work, so it's important to really feel passionate about what you do and feel appreciated and get excited to go to work. So I love that piece of my Monday through Friday job. But as a nurse, I think probably one of the most rewarding things for me is just the incredible honor. And I'm going to cry because when I think about it, it's just, you know, there are very few times in people's life that you get to be a part of a very vulnerable personal experience. And there are two that come to mind: birth of a baby, or the death of someone that you care about. And so, you know, working in the NICU, I've had the opportunity thousands of times, probably over the years, to, you know, be part of that very special moment and see those babies take their first breaths, and see the parents' eyes, you know, well up with tears as they welcome that baby and you know, name that baby, and just really bond and get off to that new parental role. It's just so, it never ceases to really move me, no matter how many deliveries I go to. And at the same time, I've also been in more difficult situations where, you know, I've responded to what's called a code pink, which is a child or an infant who needs resuscitation, CPR. And even in those moments, I don't want to say that they're rewarding, but there's something wonderful about having a nurse present in those kinds of moments to help the family get through. And it's a very honored place to be, because you want those memories, the good ones and the bad ones, to be as good as they possibly can be. So even in a tragic situation, nurses have the opportunity to help guide a family through those things and hold their hand and let them cry on their shoulder. And as difficult as it is, I feel so blessed to be able to be a part of that and to offer that to those family members who need it, because without nursing, it would feel kind of cold. And so, you know, that is those things. And then, you know, just there's something about going to work and being a nurse that I get excited about every single shift that I work. And I learn something new every single day, from a coworker, from a patient, from a family member, from a respiratory therapist or radiography tech. I learned something new, and I think that that kind of keeps you fresh and keeps you excited about going to work every day. So there isn't any one. I will tell you one moment. This was probably my most memorable moment in the NICU. We had a premature baby, a couple who was planning to get married, and of course their plans fell apart because of the birth of this premature baby and all of that. And we wanted to help this couple's dreams come true. So we hosted a wedding in the NICU.
No.
We ordered a cake from Old Town Bakery. We pitched in money and bought a nice gift from Von Mar. We arranged everything. We had someone doing photography, and that couple got married in the NICU in their baby's room. And it was just such a special, like, what other career do you get to do these things, you guys? I can't think of one.
Not future ready coaching, I'll tell you that.
It's cool. It's pretty
Where
good.
was I for the cake? Why didn't I know about this?
You know what, Tori? I think it was before your time, girl. This was probably like 15 years ago. Well, it was 2008 or 9. So, yeah.
I'm 2011.
Oh man, you guys are wonderful. All right, Tori, let's see. Tell us about it. Your best day.
Okay. Well, I can tell you my worst day and probably why I got into respiratory,
Okay.
other than the fact that I figured out that I did not work well from the waist down. All RTs will tell you that. We work from the waist up. Meg, and she knows the truth. So other than the fact that I figured that out, my younger sister had given birth to a baby who we knew in utero that there was something very wrong with it, but we weren't quite sure how bad it was going to be. And at the time I was in nursing school. So I had just started. I didn't have any experience in NICU anything. I had never even touched a baby this little. So we had to deliver it early because we knew it was not going to make it till the end if we didn't. So she had a C-section, had the baby, and it ended up having spinal muscular atrophy. And it had like the worst case of it, which Meg might be able to know. I don't know. There's different levels of it, but it was the worst one. So, it was intubated right away and on a ventilator. And at the time I was in there at the bedside every day. And I was like, I would see this girl come in and mess with the vent and the tube. And finally I said to her, when I said, are you a nurse or like, what is it that you do? And she said, no, I'm a respiratory therapist. I just take care of the breathing part and making sure the tube's in place and, stuff like that. And I thought, wow. And it was University of Iowa. And so I started asking her more questions. She said, well, I work only in the NICU, but you can work in other places and, things like that. And I thought, wow, that's kind of cool. Like every day I could work somewhere different.
Mm-hmm.
Like, she's like, yeah, if you were in just the regular hospital, like she goes, you might be on, a med surge day, one day, and then the next day you might be in ER, and the next day you might be in ICU. She goes, it could be different every day. And I was like, so instead of like nursing being on like, hired in one place, not that you couldn't change that, but I can change that day to day. I can.
Mm-hmm.
I really liked that about it. And the care that she gave this baby, we also found out that it had locked joint syndrome. So joints were locked. And to get her out, they had to break 2 arms and a leg to get her out. And then later on, the nurse was changing the diaper. It was not her fault and broke her other leg. So we had to hold her on a pillow and pass her around because you couldn't touch her because it would break other things. So I think going through that experience, and my sister was only 17, so she was very young, and I don't even think she processed it very well. So I think going through that experience with her and like seeing the therapist come in and do all this stuff, she helped take the tube out when we let her pass. And so it was like a rewarding experience for me because I think I kind of figured out what I wanted to do, and painful at the same point. So that was that experience, and that's what kind of got me into it. But then my best day on the job was probably just actually like 2 years ago, I think. I went in to see a patient, and I had seen her in the ER. I'd seen her in the ER and had to intubate her. She was in an asthma attack, and she was completely not like coherent. She couldn't understand what was going on. She was thrashing around, and we had to intubate her. And she got all the way through the hospital. She got extubated, meaning the tube was taken out. She was breathing on her own. I saw her up on the floor later on a med surge floor. And I said, you're the lady that I took care of in the ER. And she was like, oh my God, I can hear your voice. She's like, your voice sounds familiar. And I was like, what? And she said, I knew that voice. You were talking to me. She goes, I couldn't move, but I could hear you. And I was like, right away when I started talking, when I came in the room, she like was looking at me funny. And I was like, that's weird. And she goes, I know you were there. She goes, oh my God, you saved my life. And she was just bawling. And then I'm bawling. And she's like, I've never had an asthma attack like that. And she goes, I didn't know that when you put somebody to sleep that you could still hear their voice. She goes, I heard your voice the whole time.
Oh my gosh.
I know. I was bawling. And I did remember saying to her in her ear, because she was coughing a lot. And I said, it's going to be okay. Take a deep breath. We're going to get you some more pain medicine. And she said she remembered all of that. So that was probably my best moment.
Well, yeah.
You know that you have to be appropriate in the room, even if you think somebody's asleep.
You learned.
Yeah. So that was probably one of my best experiences. And, you know, like Meg said, she likes to be in the NICU. She's, you know, a baby nurse. I can tell you, and she would probably confirm this. I am not. I go to that area because I have to. I don't. And I thought because I went through that experience with my niece that like, that's what I wanted to do. I was like, I want to be a NICU therapist. That's what I want to do. And then when I graduated and actually had to take care of the first baby myself and actually like I was the RT, I don't like this.
No.
They're so tiny. And sometimes they're like, you know, this big. And I'm like, I don't even want to touch them. I'm afraid I'm gonna break them. And it's not my area. I love the RTs that come from Peoria to pick babies up and things like that. I'm always like, oh my gosh, how do you do this? Like, so good at, and they just like the nurses, they fling these babies around like they're nothing, just, you know, and I'm always like, oh, don't touch them like that, you know,
Fling them around.
they do. I'm always like, oh, they just move them all. And it just makes me so nervous. So I know for sure that I'm an adult care respiratory therapist, whether ER, ICU, I don't belong in peds or NICU, but being where I work, I have to be able to do that. So I do have a certain amount of professionalism that I have to go into those areas and I have to do what I have to do.
Sure.
And I take care of it, but I would not go and work in Peoria in like.
Well, it's good to know your strengths.
Yes, exactly. Just like the nurses, they have to know where their strength and where their area is. I'm the same way.
Yeah, definitely. Well, I was just about to ask like 6 more questions because I'm having a great time and I just went down and realized it's already 11. Oops. So we could definitely keep this going. And I know that our students will have more questions once they take all this in and really think about it. So students, I know we can connect you with any of these 3 wonderful women to keep the conversation going and that they'd be happy to help. So please let us know as your school representatives if you have any questions so that we can connect you with these 3 women. And thank you, all 3 of you, for everything that you have given us in this last hour, even the tears. I appreciate them. But I love you all so much and I'm so thankful for you. And we really just appreciate your time. So I think that's it. I know I have kiddos that need to get to their next class, so we'll let them go. And I'm just so grateful for all of you. So thank you very much.
Thank you so much, everybody. It was great.
Bye.